January is International Quality of Life Awareness Month. Now, this month-long event was first created in 1994 with the purpose of promoting and encouraging people around the world to take steps toward improving their quality of life. And during this month, people are encouraged to focus on what's important to them and make positive changes like getting more exercise, eating healthier, or finding ways to reduce stress. Our medical contributor, Dr. Ogechika Alozie with Sunset West Health, is here with some things you should know about your health and how it affects your quality of life.
Let's do it.
Doctor, the first two graphics are very important. First of all, it's very disappointing to see from the findings of the study by Wallet Hub that Texas and New Mexico don't even rank in the top 10 for quality of life. Let's look at that. Holy cow.
I will take a victory lap here because I did grow up in Minnesota. It's up there at the top. But again, I mean, this is complicated. It's not just a question of being Texas or New Mexico. Look across the South, right? And so we can throw in some socioeconomic issues, some political issues, some healthcare funding issues. And it's ironic because some of the best quality of life is in places that are cold, and there's actually some biophysics around that, but conversation for another day.
All right, and U.S. News and World Report also recently releasing its list of the 10 best places to live for quality of life. Interesting. Only 2 in the top 10 are cities west of the Mississippi.
Exactly. And again, all top 10 are in cold weather cities, right? And so again, conversations about healthcare, how they fund healthcare, who's managing the healthcare, public services. But again, part of that's a conversation for another day.
And our Be Mindful reporter Avery Martinez will be happy with this. Good mental health is a key part of quality of life.
If you look at what Americans are worried about the most, it is mental health. And that has gone up post-COVID, you can see. But obesity that we'll talk about, cancer that we've talked about before, mental health is part of stress, and the coronavirus, thankfully, is dropping down.
And exercise and mental health, of course, go hand in hand.
So I think one of the things, you and I talk about this a lot, is you have to sort of figure out where you are, where you want to go, and what you can do. Always remember that exercise, no matter how limited it is, you don't have to be a gym rat and throwing weights around, but making friends, talking to people, going on walks, all of those count to improve your overall global health.
Well, for people who are obese, that can have a direct effect on their mental health, right?
Absolutely. And so as somebody that has been large at various points in my life, I think the limited physical ability for me has been the worst, multiple surgeries. But again, there's a stigma around obesity. People have poor self-image, impaired sexual function. You get passed over for promotions at work. There's a lot of data around that. And if you're passed over for promotions at work, impaired sexual function, you can feel disempowered.
Now, how does loneliness affect your quality of life?
You know, what we have seen is that there's a lot of data around people that are alone living shorter lifespans. Going out with friends, having a drink. There used to be this data around drinking wine can actually improve your lifespan. It's not the wine. It's the people that you're drinking the wine with. And I think that's important as we go through this social media period where people are focused on their phones and not on their friends.
And here's the benefits of having stronger social connections, right?
Again, I think the last one's, for me, one of the biggest keys, which is increased chances of living longer. The more social connections you have, the more friends you have, it actually strengthens your immune system, your mental health, and it can reduce some of those mental health things we talked about in terms of anxiety and depression.
Talk about how chronic pain can affect the quality of life.
Yeah, so again, I like to turn things back on myself. To give an example, I've had 14 different surgeries, knees, hands, shoulders, and pain sucks, right? Yeah. And so when you can't move properly, when you wake up in the middle of the night in the morning and you sort of feel like an old engine, all those things affect how you engage with the world, and it can limit your interaction with friends and that exercise that we talked about.
Now, explain the differences between palliative care and hospice care and the benefits when they're used together to help quality of life. I found this interesting.
This may seem morbid, right? We're talking about quality of life, but what people don't realize is 80 to 90% of the money that you spend in healthcare comes in the last 2 years of your life. And so palliative care is for people with cancer, chronic debilitating illnesses, and it's care that you can get to make that period more gentle on you, less painful. Hospice is that end-of-life period, and we have a lot of conversations with patients that are chronically ill, terminally ill. When they're put together, it's not just the patient that benefits, but it's their family in those last days to years of life, and that can improve their overall mental health.
All right, finally, we have a lot of resources to share here.
Whether it's emergence, NAMI, suicide prevention line, I think the key here is mental health is health. It's one of the things that your KVIA has been talking about, and I think that's really important. And it's not just that. I put a smorgasbord of organizations together. Be active. No matter how limited that activity is, it's important. There's a host of primary care. You and I focus on primary care. And if you're in pain, get help. There's ways to get around it.
ABC7 medical contributor, Dr. Ogechika Alozie. Thank you, sir. You did well.
I know, we did good.